Good afternoon, dental internet world. My name is Dr. Vishal Sharma. I'm once again here alongside my friend and colleague, Dr. Mike Parchewski.
Now we're going to pick up part 2 of our interview with Dr. Nicole Robins. To see the first part, tune back in to podcast 34.
I know that you're really passionate about a multidisciplinary comprehensive case that we were discussing before off camera, and you had some really interesting components to work with on that. And maybe some lessons that dentists can learn or take from that case. So Nicole, can you walk us through that case in particular and even start from the beginning on some of the social components on that case and why it was so interesting for you?
Yeah, for sure. One thing that I would love for dentists to know and that I've really tried to drive home is communication. Just literally take the time to let your patients tell you what they want and your treatment plans are going to explode. Second, you cannot always get what they want immediately. And so that's when education with the patient comes into play. This case, the patient came in and he wanted a smile transformation, and his occlusion was absolutely not suitable for what he wanted. And I said, okay, we can get you this. Absolutely. But here's how, and here's why. And he went from losing teeth over the years, from cracked teeth and failed teeth from caries, and not really putting any effort into restoring anything. He didn't understand why it was important to have that posterior vertical dimension. And a lot of it was just he didn't understand, and nobody had ever taken the time to educate him on his options or why it was important to be proactive. And so after the exam, I kind of walked through, I know you can't see your back teeth when you smile. I know you don't care that other people can't see them, but listen, this is what's happening without your back teeth. And if I put all of these anterior restorations in the way they are right now, you'll be happy for about 6 months, and then they're all going to break and you're going to be mad at me and etc. So just outline, what they want and why it wouldn't work in that way. And then walk them through, okay, look, here's what we can do to get you what you want. You need orthodontics. You need that posterior support. So, he wanted it bad enough that he was willing to, after I educated him on why all the other stuff was important, he was not just willing, he was more than happy to go through a full 1.5 years of Invisalign implants, and he's now cut that red ribbon and we're on to doing his anterior top and bottom veneers. So that was pretty profound to see a mid-50-year-old man go his whole life just, going in and out of the office, not really having anything done, and then finally being educated on what his options are. And then, bam, all of a sudden, and I asked him, I'm like, why all of a sudden? He's like, well, I just didn't know it was an option. And
where did this patient come to you from, Nicole? Was it already a patient in the patient base, or was this individual referred to you?
It was a patient who had been at a neighboring clinic for years, and word of mouth, they had come. Yeah.
That's cool. Isn't it interesting how, back in the day, everything was about, taking away tooth structure and veneering. And Invisalign and more comprehensive dentistry has allowed us, and now today, Vish and I are big Sure Smile users, but aligner therapy in general have really given us that ability to do a lot of pre-prosthetic work, right? Less is more in dentistry, I always say, and no news is good news at my recalls. And it's that idea that if we can put things in better position first before we do the cosmetic, we have much more profound result. Now, I've got a couple questions for you, but the first question I wanted to ask is financially. These patients that are coming to you, obviously these cases are not inexpensive. What is the workaround, or how are you helping them to be able to afford that? Is there any strategies on case acceptance and the costs?
Absolutely. So that's actually one of the reasons I did get into composite veneers as well, is because not everyone can afford $20,000 porcelain smile. So they'll do the composite first. However, I honestly, I never look at if people have insurance. I purposely don't look because I don't want it to influence my treatment plan. I really try to put costs out of things and just educate the patient. And it's been pretty surprising to see people's priorities switch from, it's just really all about priorities. And a lot of people can afford it at the end of the day if they choose to, if they decide it's important enough. So it's all kind of circling back to communication again. Kind of funny backstory. I cried in dental school in a lecture because the instructor was talking about how, not everyone can afford dentistry. And I knew that, but it just, I want to be able to help everyone. And the instructor comes up to me after, I'm like secretly crying in the back. And he's like, I've seen people turn down my treatment plan and then go and buy a TV. You can't feel bad for everyone because it's all about priorities. Now, that is a large amount of patients, but there is some people that genuinely want it and they genuinely can't afford it. Maybe something happened in their life, etc. And this is why, again, I get to know the patient because I get to know, okay, they actually want it, but they can't afford it. I know they're super motivated. What can we do for them? So in those rare circumstances, we will do a 3-month payment plan for them. And if it's Invisalign, we can break it down all the way into a 12-month payment plan, and that makes it very reasonable for most people. And then if the aesthetic component, we can mix it in with that. So they got a whole year to pay it off. Now, if they're not doing Invisalign and they're just doing anterior restorations, 3 months is the most that we'll do. That's pretty fair for the front office. Because now that becomes that's more work for your whole team, right? So you have to be careful about what you're offering and make it fair and reasonable to the patient and also reasonable for the staff as well.
It's interesting that you mentioned that lecture where you clearly developed some empathy. Mike slept through that lecture in dental school, and now that explains a lot more about him than it ever could have before this podcast. So
he's just giving it to you today,
huh?
huh?
Well, the crying in the lecture happened for me as well, but it was actually when I accidentally went into Bish's lecture. I showed up early in Toronto and I was at his lecture, and yeah, there was tears. Tears were flowing.
Tears of happiness.
Yeah.
No, I don't think
obviously.
Yeah. So tell me one more thing too. Like, we know that in our world, digital and photography is so important. Not only is it important for planning your case, but it's also important for case acceptance.
Totally.
For you, what is the one piece of technology that you find is educating your patients the best, whether it's to accept or whether it's to help you get where you need to be? What do you find? What's the one piece that's big for you?
The camera is huge. My macro lens shows detail and it shows people a smile. It shows them the way we see teeth. They don't look at their teeth in the mirror and see it the way we do. But when I show it to them close up where it's literally just their teeth, they're usually horrified. And that is all that needs to be done. And they want to do something about it ASAP. So the camera is huge in case acceptance. And I'm not going to lie, it was, I found it challenging to learn dental photography, just being really busy in my practice. It was hard to set time aside. I'm getting home in the evenings and then you got to spend all night, learning photography. And there's a couple different ways you can approach it. You can memorize the 3 settings that you need, get your flash ring and point and shoot and go. And honestly, you'll get pretty dang good pictures. You'll get what the lab needs to have good communication with them and good before and afters. But learning the photography to get a little bit more artistic with it, to showcase different teeth in different ways, that's pretty challenging. So I'm still working on that for sure. And I'd like to get into portraits and stuff as well.
Dr. Gordon Chi,
yeah.
he's somebody that I know teaches a lot of the photography part. And I think from my perspective, when he went into that clinic, I think that was to me, the birthplace of his cosmetic world was his photography, which is, I feel like, second to none. And it's huge, right?
Yeah.
It's a before and the afters, but it's that communication piece, right?
Yeah.
And
yeah.
So, go ahead.
Sorry.
Nicole.
No, I was just going to say big shout out to Dr. Chi as my mentor since dental school because he has influenced me largely in obtaining the camera and doing, getting all of that going. So seeing him incorporate it into his practice, because I'm the only dentist at my practice who does a lot of this, and I'm the only one who has a camera, and it's actually been pretty challenging incorporating my method into the practice. And so that's another one little tidbit for young dentists is don't think that how you practiced is based on the practice you're a part of. You can make it how you want it. You're autonomous, you have your own patients, and you can practice it the way you feel it's best suited. So, my family is, my practice is very like family comprehensive, like go. We're busy. And it was hard incorporating photography in there. Like, how am I going to squeeze an extra 10 minutes to get those before and afters? And I really wanted it, so I made it work. And you have to have the team on board as well, training the RDAs, how to take the photos with me, and getting them quick at scans and such.
Yeah, those are certainly strong words of encouragement with building that practice within a practice. And I think that goes for a lot of people for Gord. He's been a mentor and a great advocate for comprehensive dentistry for a lot of people. And he's one of our first podcast guests as well.
Yep.
So Nicole, discuss how that photography aspect, that attention to detail, how you pivoted that to social media, and how has that helped you drive patients to your practice space?
Yeah, absolutely. So I first started the Instagram purely just for my growth. I didn't care if anyone saw my page at all. I didn't care to grow it. I literally just wanted to be proud enough of a case to put it out on into the internet world. And it's very motivating. Chairside, if you're having a bad day and you're like, I'll finish this up. No, got to post this. It's got to be perfect. And I hope that dentists are that motivated regardless of posting it on Instagram or not. But it is just that extra little oomph for people. It's accountability. So for me, I started the Instagram for myself. And then I've been posting more. And now that I'm joining Dr. Chi's practice, it is going to become very important in obtaining my patients. That's a large draw for him. That's how he gets a lot of his patients. And so I need to, get up to par with that and start drawing in my own patients through Instagram. But yeah, the photography is huge for that. And I'm developing right now. My boyfriend and he's creating his own little Instagram page for his financial wealth business, and I'm ramping up mine for dentistry, and we're huge nerds, and every night we collaborate. And I would say don't be eager and quick to just throw cases up there, have a method to your madness and create a brand for yourself. And I've done a ton of cases, but I'm still figuring out my page, and I want everything that I post to be cohesive. So I'm kind of withholding a few things at the moment, because when I unleash it, I want it to people to see the photo and say, oh, that's Nicole's work. I want them to be able to recognize it. So to be determined a little bit on my page, but
could you go ahead?
I was going to say that's cute, going on Instagram dates with your boyfriend. Very different than the Instagram dates Mike tries to go on. So.
Yeah, I was going to say you could incorporate the dance, and so you could come out dancing, show the images, and you'd put one hand up, and there would be the before. And
right, I know I've toyed with the dance thing because it's a huge part of my life, but I struggle with that actually. Like one day I'm like, oh, it would be so great because I don't know many dentists that dance. But then on the other hand, I'm like, I feel like it takes away from the dentistry, and it's not about me or dancing. It's about the patients, and it's about the teeth and the experience. So I haven't quite figured that one out yet.
It's a terrible idea. I tried it, and it drove my patient base basically away.
So I think that we need some one-on-one dance training. I got you.
I did it, and then a pandemic started. So I don't know if there's a correlation between that, but yeah.
The COVID two-step.
Yeah.
So, as far as the dancing goes, is that something you're still active in?
Yeah, definitely not as much as when I was younger, but I really try to keep it in my life. It's been a part of my life my whole, we're just rambling here now. It's been a part of my whole life. A lot of my best friends are still teaching dance. They're directors in performing arts companies. And so that's been helpful to keep me within that community. And I can, hit some of my friends up and be like, let's go do this. I need a studio space, or let's go to class. And so having that community is helpful. But I turned one of my bedrooms in my house into a dance studio. so that's there. But yeah, it's nice to stay limber and counteract all of the dentistry that we do. So, I go and dance a little bit and I'm like, ooh, that's a muscle that we don't use in dentistry, or that I strain too much. So
yeah, and I'll say that coming from a more seasoned dentist perspective, that we do, dentistry takes a lot, right? You had mentioned it earlier that trying to do everything in dentistry, it taxes you,
Yeah.
right? And in trying to do all the CE, all this stuff, you end up getting so focused on it that you don't get to the gym, you don't get out for exercise. And so I've learned, I've got into trail running, I was doing triathlons, I did an Ironman right before COVID. And for me, it was getting out and doing something completely non-dental that I needed to do to just resync my mind, or I was going to go dentistry insane. How about you, Vish? Golf?
Yeah, well,
Chasing the dog.
I think golf is what causes some insanity for me. But no, Nicole, it's obviously admirable, one, the biomechanical benefits, but I'm sure it's also inspirational for you. Like dealing with your friends who are in choreography, there's a tie-in with that aesthetic aspect that you said's been appealing. So I'm sure the dance component would probably feed that as well.
Absolutely. Yeah. It's just another creative outlet, and keeping that, it's a whole other part of your brain, doing choreography and dance. And when I would take a little break from dances and start making up my choreography again, or trying to learn choreography, I'm like, ooh, get those gears going again. Like that part of the brain really needs to be tweaked. So it does, keeping that up does inspire me to kind of look at things differently than maybe just, a bookworm would. We're all a little bit of bookworms, but it does kind of help me see things from a different perspective, I think, and a different side hobby that I've really a lot of my friends will know this for me, but I almost started a charcuterie board company a couple of years ago because I am obsessed with just making things presentable. And so I would make these massive charcuterie boards, and I still do. I'll have charcuterie boards for dinner often. And
very morbid for someone who does a lot of gingivectomies to have a charcuterie.
Yeah. Is there an electrosurge on that, or?
So pivoting from left side to the right side of the brain, you discussed, a bookworm component. What's on the horizon for you, Nicole, for education for the foreseeable future?
Yes, it's going to be a lot. So I'm doing the COIS education, so the treatment planning and occlusion, and getting that whole week done. There's been a wait list, so that's where we're waiting to get in on that. And then I'm also doing LVI occlusion because I'm taking over some of Dr. Chi's TMJ patients, and they're neuromuscular based, and he uses the T-scan. And I also just like knowing as much as I can. So I think it's going to be valuable to learn both of those different occlusal schemes and methods, and take what I would like to incorporate into my practice and what works best for my patients. And I don't think it's wise in any aspect of life to just take one idea and run without challenging all the other sides. If you can't answer to questions that come from the other side, or you don't even know those questions exist, then what are you doing supporting the side you're on? You need to understand all those perspectives. So yeah, that's why I want to do that.
Mike and I both did the full LVI curriculum separately. And although I don't practice nearly as much neuromuscular dentistry as I have in the past, those philosophies and those foundations still serve me immensely to this day.
Yeah.
Mike, I'm sure you can attest to that as well.
Yep. I think if you understand the occlusion philosophies like of Coyce and a lot of the other big mentors out there and neuromuscular, the key things with all of them is understanding your patient more comprehensive, testing your position before you do anything, and sort of diligent on the restorative side. So I think whenever you're starting to look at the bite more comprehensively, whatever your philosophy is, I think you're going to set yourself into a better position for those restorations to have a longer lifespan.
Yeah. Yeah, you're only helping yourself.
Nicole, this has been such a fantastic interview. Your passion clearly shows through, and you've certainly been one of our most engaging guests. Mike has a follow-up question to ask what you're planning for the summer. I know you said you have no plans, so I'm not going to let him ask that question because I want to finish this on a high note. And so Mike and I think, are really interesting to when you take your passions and your education to the teaching platform. We'll be certainly signing up for your course when that day happens. So something on the horizon. I know you've got a lot on your plate, but that would be a future goal. And I think you would be fantastic at it. Certainly drawing some tears from the audience members, I'm sure.
Well, who knows? We can maybe fit you in on the backdrop here. So I think, super admirable. Again, thank you so much. Thanks, Vish. And thanks to everybody for tuning in. And for anybody that's wanting to subscribe and see what more we've got going on, easiest way to find us is at Digital Workflow Dentistry on our Instagram. All the links are there in our bio. Please like and subscribe. Follow us for more. Our YouTube channel, Digital Dentist. Thank you so much to Nicole again. Thanks to Vish. And take care, everybody.